welcome everybody to our, I think it's our 6th or 7th. We need to start numbering these episodes of our blab. We have a weekly blab. Name of our company is Alternative Health Concepts. And my name is Mike Warren. I'm the president of Alternative Health Concepts. And what we do at Alternative Health Concepts, we are primarily an information company on alternative ways to better yourself, heal yourself, and help your body heal itself. We have some nutritional supplements that we sell that help in those areas. And one of them is called biopro-plus. You can get online and look at that or see it on Amazon. It's a great immune modulator, and it helps modulate and equalize your immune system. And it's a bioidentical protein in your body. So enough of the advertisement, though. That's not what we're here for today. We're here today to talk to I consider a special guest. I'm really excited about it. What those of you that follow Alternative Health Concepts know that every Monday we put out 5 of the what we believe, our team believes, are some of the latest, greatest websites and some of the best information that's being put out on the web. And a few weeks ago, Dr. Lopes' website was one of our featured sites on our Monday newsletter. And so with that, we've gone and we've kind of talked to some of those people and said, hey, would you like to come on our weekly blab? We have these weekly blabs. Most of them don't have any idea what you're talking about. What are you talking about, a blab? But you know, she willingly stepped up, and I don't think she had ever heard of it. Had you ever heard of the blab? Yeah, so it's so relatively new, but it's really an exciting platform. So any rate, so she said, yeah, I'll come on, and she jumped on, and that's what we're here for today. So without further ado about that, let me introduce to you Dr. Chandy Lopes. She is a naturopathic doctor, ND. She graduated from the prestigious Bastyr University in Seattle, Washington. She resides and her practice is in Maui, Hawaii. Is that correct?
Yeah.
Is that right? So
yes.
Before I go on, I already blew it by not giving out a big aloha to you. And welcome. I should have done that first, but I'm not quite used to it. I told her the other day when I was talking to her, getting ready for the interview, that's one place I absolutely love. I've only been there twice in my life, but I'm anxious to get back. So maybe she'll give us a good reason to get back. Getting back to her education and her experience, she is a practicing naturopath. As I mentioned, she's experienced in pediatrics, women's health, and general patient care. And the thing why I really wanted a naturopath on our lab today, and what I wanted to talk to about, is she's also a primary care physician. A lot of us that have grown up, particularly in the United States, are used to our regular MD, our general practitioner that we go to, and they have a certain way, we call it allopathic medicine, of doing things, which is good and it's helpful, and it's something that most of us have grown up with. But recently, it's really, I know naturopaths started 100+ years ago, naturopathy, but recently there's been a real jump to naturopaths, and because they just do things differently. And that's one of the things that we're going to explore today, and I'll let her tell you more of that. I've had personal experience with my wife going to a naturopath and just really found it a really nice alternative, if you will, to the traditional medicine where you go in and you see your doctor and you're lucky to have 7 minutes and he'll write a prescription and be done with you. I found, from my experience, quite the opposite with naturopathy, and actually enjoyed over a 2-hour first session with my wife and I when we went to one here in Southern California, and just a wonderful experience, a more natural approach, which goes hand in hand with what Alternative Health Concepts is. As far as prescriptions have their place, but we believe there's a lot of wonderful natural alternatives to prescription medicine, and that's what we're all about. So without further ado, I'm going to turn the time over to you, Dr. Lopes, and introduce yourself. Tell us about you. Tell us about your story, where you grew up, what got you interested in naturopathy and why you decided to become a doctor of naturopath. So with that, it's all yours.
Great. Well, I grew up on Maui, and I decided I was going to be pre-med. So I went to Colgate University in upstate New York, and I was on the pre-med track. I was also majoring in religion, so not really fully science oriented. I needed the other person aspect of it. And I realized through that track that I had a few issues with the pre-med track regarding the intensity that was required, and also that I realized I didn't trust the medicine that I was supposed to be teaching either, because I was having some just irritable bowel syndrome symptoms, but I didn't want to go to a regular doctor. So I realized, hey, if I don't want to go see a regular doctor, then I shouldn't be doing this medicine, because I'm not going to want to teach it to other people or to help other people or promote it. Basically, it wasn't part of my value system. And so I was lucky enough to research online alternative approaches to what I was experiencing. And I happened to find Bastyr University and other naturopathic medical schools. And I went and researched on it. And like that night, I changed my mind and decided to become a naturopathic doctor. And as I've learned, because it's 4 years you're in your undergraduate, and then you also go through graduate school, and that's 4 years of basically medical school with a residency or an internship afterwards. However, not all naturopathic doctors go ahead and get the residency, because there aren't enough opportunities for the students and the graduates to go ahead and get a residency. So I opted to come back to Maui because I knew where I wanted to practice, and there weren't any residencies here for me. But I was fortunate enough to actually meet another doctor here on Maui who hired me, and it sort of morphed into my own internship residency, as you will call it. So I've been doing that for the last 2 years, working with her and seeing my own patients at the same time. And it's been a very fun experience. It's been great to work in a place that I love, to see people that I care about, and to teach them about naturopathic medicine, because not many people know about it. Yeah. People like you, Mike, and the people here today in the webinar are very unique in terms of having heard about natural medicine and wanting to go an alternative route. I believe naturopaths are really only licensed in, and this may be wrong, but it's like somewhere around like 20-ish states in the United States.
Wow.
So there's not too many states that have licensed naturopathic doctors. In addition, I think one of the questions you wanted me to talk about was insurance coverage, like are naturopaths covered by insurance? And technically, because of the American Care Act, or AKA Obamacare, we are supposed to be covered by insurance companies. However, compliance is few and far between. I think the best states with insurance compliance are Washington, Oregon, and Arizona, primarily because they have schools there of naturopathic medical schools. And so it's very well accepted, very well established. And it's the norm to go and see a naturopath first instead of a medical doctor. In Hawaii, for example, our association is still having to push to get that coverage. And we're trying to promote and encourage people to step up and tell their insurance companies, this is what we want and this is why we want it. So I guess the next that would lead me into the next segment, which would be, well, why would you want to see a naturopath? What would we have to offer people? And really, naturopathic medicine is a cheaper form of medicine because we emphasize prevention first, and we emphasize finding the cause to the illness, not just treating symptoms. So if you come in to see me with gastrointestinal reflux disease, I'm not going to give you an acid, go and take some Tums, come back and see me. Really, I would want to talk with you about, well, what's causing the GERD? Sometimes it's stress. People live really high intensity lifestyles without the self-care that's required. So that can cause a lot of anxiety. The anxiety can cause an increase in acid in your stomach, which can cause you to have regurgitation when you eat. Plus, with our poor lifestyle, that would be another way of addressing GERD, would be to look at the types of food someone's eating, when they're eating. Some people don't associate that maybe they're eating dinner at 9 o'clock at night and then they have reflux. Well, if they tried to eat at, say, 6 o'clock at night, that's a larger window of time for digestion. So those are some of the things that naturopaths are trained to look at, and how we approach things.
Interesting. Real quick, can I jump in there real quick? Because we had a question. What's the difference between a naturopathic doctor and a naturopath? It's the same, isn't it? Or are they one and the same? Are they synonymous?
Well, so it depends, and they probably are not the same. If you're looking at someone and you want to see someone and you want to make sure they're licensed. So if they're saying naturopathic doctor, that means they're a licensed ND. Okay. If they're just saying they're a naturopath, that could mean that maybe they did some online training into natural medicine, okay, which wouldn't necessarily be helpful for you, for anyone wanting to find an alternative doctor. The other thing with naturopaths and naturopathic medicine in general is that we're very diverse. We're an incredibly diverse field, and each doctor is different. So when we go into school, we're all trained as primary care physicians, which means basically we learn how to do basic exams. We learn the gamut of health concerns, and how to do an intake, workup, medical exam, blood draws, the basics. And then we also learn the alternatives. So we know about how to treat conditions with herbs. We learn about how to treat conditions using natural water therapies. We learn about physical medicine, and we do a type of manipulation that's somewhat like chiropractic, but a lot more gentle. We also use homeopathy, which is a type of energy medicine. It's really difficult to explain, but it's basically where like cures like. It's based on these principles of homeopathy. So we learn all of these that we use in our toolkit to treat conditions. And when once we start to learn these conditions, each doctor begins to specialize naturally, because we all have our own interests. So your wife went to go see a naturopathic oncologist. She specialized in that, and she got additional training to effectively treat cancer. And I'm sure she does continuing education with naturopathic oncology, and I'm sure she's been not licensed, but she's gotten additional certifications. Yes. And then some naturopaths decide they just want to do homeopathy. So they're just strictly homeopaths. And then other naturopaths want to just see pediatrics or pediatricians. Some are midwives as well.
So what are some of the areas that I mentioned that earlier. What did you go into, or what are you? You're still young in your practice. What areas are you going into personally? What are your passions? As far as that's concerned.
The things that I tend to be drawn to are regenerative joint injections, prolotherapy. I'm going to get certified in PRP as well, because it's platelet-rich plasma, which is another form of regenerative joint therapy. It's kind of like the next step. It's the next level. It's basically where we take people's blood, we spin it, and we get the platelets, the platelet-rich plasma, and we inject it into the joint space. And there are growth factors within your own plasma that can help regenerate the ligaments and the collagen within the joint that's been injured or that is causing pain. I'm also really, and regenerative joint therapy is also related to diet and lifestyle. It's related to environmental toxicities, because, and this is sort of, I'm kind of jumping the gun, but I'll try to explain a bit more about what I mean. It's that none of these things you can't treat a person in isolation. So when someone comes to me for chronic knee pain because they've had multiple injuries to their MCL or something, I'm not just going to be looking at their knee in isolation. Okay, let's just go ahead and do a knee treatment. What's also important to consider is, well, how old are they? And do they have the nutrients that they need in order to rebuild that collagen? So do they have, are they supporting themselves with glucosamine and chondroitin? And are they taking it in the right doses? Do they have a lot of exposure to toxicities like heavy metals, lead, mercury? Those things can make it difficult to rebuild as well, because.
Would you do tests for them for that? Let's say I was in your office right now and I happen to have sore knees, and this was one of the things that attracted me to you. This is the prolotherapy, as I mentioned the other day. So if I was sitting in there in your office like I'm right now, would you do a series of tests to find out those heavy metals? Like, I may not know that I have have the heavy metals in me or not. I don't know that. So explain some of that, how that works with you.
Right. So you would come into my office and I would sit down with you. We would talk about what your common complaints are and say your common complaint is, or your chief complaint is the knee pain. So I would ask you, your history. Have you had injuries? Is it just age related? Is it autoimmune related? Is it caused by some other like higher up pelvic tilt? I would go ahead and examine.
So I'm 57 years old, and I tell you, I have no idea. It just hurts.
Right.
So I'm a blank canvas at that point. So now you're gonna start doing some tests, obviously, and start working backwards, because I'm not going to be any help to you.
Right. So I would do a physical exam.
Okay.
Yeah. I'd look at your knee. I do a couple of general physical exams. And then if I was concerned that maybe it wasn't just osteoarthritis, I would recommend doing a blood test. If I thought it maybe had something to do with rheumatoid arthritis or another autoimmune disease, then I would run blood work with that. Okay. If I was concerned that you had a history of environmental exposures, like say you worked for, what's it called? The county that you live in, and then you paved roads at night, right? That's a lot of exposure to toxicity. So I would want to do probably a heavy metals test. We could maybe do urine or hair. I would also look into your diet and make sure that you're actually eating food that's appropriate for you. Because, and you might have heard this, but sorry, I got distracted by a question. You might have heard this, but inflammation is pretty much the #1 killer. Inflammation can be traced to a plethora of disease, from heart disease to autoimmune disease to generalized pain, chronic fatigue. And so, if you look at the underlying cause of inflammation, one of which is our diet and the food that we eat today. Highly processed, highly packaged. It's not only what we eat, but it's also how we eat it. And most people don't really sit down to eat a meal anymore. Many people don't enjoy the meal. They just kind of scarf it up because we're so busy trying to get to the next thing. So yes, I do both hair mineral analysis or urine. I don't do blood typically, because blood will only show an acute exposure. So you'd have to have been exposed within about 3 days. It's not going to show the storage in your fat, which is preferable in terms of hair mineral analysis in urine. And you'll get people saying that it's not necessarily accurate. I think it is. I've seen it. I've seen it come back with elevated levels of lead and mercury in people, and then we go ahead and do a protocol to get those things out, and they start to feel better. How people go ahead and treat heavy metals is different depending on the practitioner. Some go pretty heavy, hardcore with IV chelation, which is basically you go in and you get an IV of some kind of substance like EDTA or DMSA, and it helps to draw out the heavy metals. Sometimes you can get really sick with that. So not many people want to go that way. And then you can also do a gentler way. So that's where again, it's very practitioner specific, and finding the right practitioner.
When you say you get sick from that, it seems like if you're getting the heavy metals out of you, wouldn't that make you feel better? Explain that a little bit. What did you mean by that?
Well, when you first start to get things out of you, it's a detox reaction. And so you can get what's called a herxemer. So you can get nausea, dizziness, feeling faint, maybe a little bit more fatigue because it's suddenly in your system again. Basically, when we're exposed to toxins, our body tries to do everything it can to store it away so that we can go on living, right? Okay. That's why we're still alive. Yeah. If our body wasn't working and wasn't able to sequester those heavy metals or any kind of toxins, we wouldn't be able to function well. And so when we use EDTA or DMSA to get those back out, it's suddenly now into our bloodstream because our body needs to get it out through your urine, through your liver, and out through your GI system and through your sweat as well.
Is that just a short-lived? Does it take weeks to get that out, or is it months, or is it a short-lived pain sequence that you go through as far as the insult to your body?
Mm-hmm. Some people are different. Some people can recover and be fine within 2 weeks. Okay. Some people, it may be a little bit longer, and it depends on the intensity. So if a person is super sensitive and they respond and react really quickly, then it would be better to go slower with a chelation protocol. But if someone's really hardy, they've got good vitality, and they're like, oh, they're fine, then that would be a candidate who would be more likely who could handle, their body could handle more chelation.
Okay, yeah. Great. We had a question, I think you touched on it, maybe you answered it, and I didn't really hear it totally. Do you do hair mineral analysis or blood or whatever, I guess he was asking?
Mm-hmm. Yeah. We do more hair mineral and urine because blood will only show an immediate reaction or immediate exposure. Sorry.
Okay.
Yeah. So if you ate fish with mercury, you could have a positive blood mercury test, but it's not going to show what's stored, and it's really what's stored that's important.
And so the urine tests do a better job of that as far as that goes, or the hair analysis as a rule?
As a rule, no, I don't think so. I think they're both pretty equivalent.
Okay.
It kind of differs a little. The hair mineral analysis will also show some other nutrients, and it really depends on who you talk to, what their preference is.
Gotcha. Okay.
A lot of times I'll ask the patients what they want, because frequently patients who see naturopaths are well educated and they've already done their research and they kind of know what they want many times. So if that's the case in terms of someone comes in to see me and they want to do an assessment of their heavy metals, like I had a patient, for example, and he was a male, probably about, I think he was 60s. And he came in to see me and he wanted to test himself for toxicity. And he knew he wanted to do the hair mineral. He didn't want to do the urine. So I was like, okay, that's fine.
Yeah.
And then cost is another thing too.
So Randy, just way of technical difficulties we may be having with your questions, Randy, put the slash before the Q instead of the Q first. But Randy asked another question along the same lines. He asked the question earlier, doesn't hair show more of a history as opposed to something else, which I'll let you answer that since I don't know the answer to that.
Hair shows more of a history compared to urine. I'm not sure that I'm entirely I understand your question, but I'm thinking of it in terms of when we do a heavy metal test, we also do like what's called a pre and a post test for the urine. And the pre-test shows just what's coming out, and generally there's not much coming out of your urine. It's a very small amount. Then we give what's called a little push with a chelator. So we give about 1,000 milligrams of DMSA depending on a person's weight. And so that will hopefully push out, it's a bolus dose, and that will hopefully push out the stored levels in the fat. And so that's how we can estimate what, how much heavy metals are stored in fat. But in terms of your history, I'm not really sure what you mean by that. If you want to explain a little bit.
Yeah, and in fact, at this point in the webinar or blab or whatever we want to call this little session, if any of those of you that are in the audience, there's an open seat right now. If you'd like to come in and maybe expound a little bit on your question or explain it a little differently, Randy, grab the seat and you're welcome to come in and ask the doctor anything you may like. And that's open to any of you. So heavy metals in fat, okay, so I'm not sure about that question either. I think it was Travis that might have asked that. So keep going with what you were saying along that lines. Okay.
I know that some people do prefer the hair mineral analysis, and they do believe that it is a much more accurate measure of heavy metals. But I also know that the urine can be just as accurate. So it really depends on also what you're using it for. I hope that answered your question.
So depending on, I guess really what I would like to know from a naturopathic doctor's perspective, it sounds like you're looking at basically the three different areas of testing, some of the hair, urine, and blood, and depending on what you're looking for. Maybe it's really the real answer to that question. It really depends on what you're testing for, maybe which end you go with or which test you use. Is that accurate? Would that be accurate?
Yes.
Okay.
Yes.
Okay.
Yeah.
So hopefully that answers.
And sometimes we use saliva as well.
Okay. So there's another one that we haven't even talked about.
Great.
So talk to us a little bit. You kind of touched on it, but go into a little bit of the differences between typical allopathic medicine, like you were actually studying when you were in pre-med, and to the naturopathic realm. So somebody has a disease, let's say chronic fatigue. Somebody comes with you with chronic fatigue syndrome, which is really becoming epidemic here, at least in the United States, and I'm pretty sure worldwide. What are some of the things that you would do that would be different than a traditional Western medically trained doctor would do, or MD?
So for someone with chronic fatigue, I would look into, their social history. Are they being well supported? Are they in abusive relationships? Are they happy? As well. I would also look into their history of exposures, in terms of like, have they had significant illnesses, in when they were younger, maybe during their 20s, depending on how old they are, how many children they've had. Hormones can have a significant impact. A lot of times people with chronic fatigue are usually female, more often than males. And so there's some debate on debate and research on causes as hormone imbalance. Right now, the big topic with chronic fatigue is mitochondrial research and looking into mitochondrial deficiencies as being associated with causing the chronic fatigue, because mitochondria are basically our energy sources all throughout our body. And when they get backlogged, they don't necessarily produce energy. So that's one area of research, looking into the causes of chronic fatigue. Also looking into environmental toxicities, including not only heavy metals, but PCPs, plastics, phthalates, pesticides as well. Those are some other things. In terms of other chronic viral infections, that's another biggie. Just these chronic viral and chronic bacterial infections. So trying to find the cause again with chronic fatigue. And there can be a whole range, which would also be, again, why I said looking into this person's history and if they've had significant illnesses in their past.
Okay, so let's say a person you've established it's chronic fatigue, and you've established that it is with a viral, it's caused because of a virus that's latent in their body. At that point, I know that in Western medicine, at least most of the doctors I've ever been to, they'll give you a prescription to maybe help with your symptoms and send you on your way, and it doesn't get to the root cause. So go into a little more. Let's say I have chronic fatigue syndrome and it's caused by some kind of viral pathogen in my body. So where would you go with that? And how would you treat that differently than giving me a prescription for the symptom of whatever it may be?
Right. Well, I would probably want to give you it's called a Myers cocktail. Not sure if many people have heard of it, but basically it's a IV injection that has vitamin C, lots of B vitamins, vitamin C, magnesium, selenium. And there's two forms. You can do like a longer IV drip, and then there's like a shorter 60 cc drip or 60 cc push. So I'd probably start there. I would look into, because the vitamin C and the minerals and the B vitamins will help push the energy. It'll help to support the mitochondria. The vitamin C will help boost the immune system and hopefully as also kind of bring down any viral loads. I think Dr. Warren here is asking a question about, do you run Epstein-Barr virus titers for CAFS? Yes, we do typically run an Epstein-Barr panel to see if those are. And then it's also a really good tracking mechanism as well as someone's on the treatment plan or the protocol to see what their viral load's doing as the person is feeling better or worse. I mean, most of the time you would expect someone to have lowered titers when they're feeling better. And interestingly enough, that's not always the case too. Sometimes it'll be the same if the person is feeling better. So it's kind of an interesting needing to look at both what the patient's feeling and what the blood work shows. Yeah.
So this Myers cocktail that you were talking about, obviously it's a little different cocktail than you'd have in the evening when you're
right. Much more nutritive.
Yeah. So tell us a little bit about what is that doing in the body that may be different from a synthetic prescription drug that a doctor or an MD may give you. What is it actually doing? Is it getting to the cause of the virus? What is it helping your body do at that point?
Well, because it's an IV, first off, you're getting it directly into your system. So the amount that you're getting is much higher than you would be getting, say, taking it orally. Because when you take it orally, it has to be digested, broken down. So you don't get 100%. But when you give it with an IV, you pretty much get close to 100%, if not 100%. And then because it is vitamin C, again, it's B vitamins and magnesium, some calcium in there. Those are all vitamins and nutrients, and they're specifically helping to, one, boost your immune system. It's also helping to kind of decrease inflammation. The B vitamins help support your mitochondria, which help give you energy, which also some other side effects. It helps with your methylation processes in your body. This is going into biochemistry. Yeah. So without getting too complicated, it's helping to decrease your inflammation and helping to make sure that your body has all the nutrients it needs to decrease inflammation, increase immune system function, and hopefully increase the energy.
Okay, so basically kind of the way we started this whole thing, in a nutshell, and we can go into more detail, but what I hear you saying is naturopathic medicine is what we believe with our company is that you have to give your body the necessary tools so the body can heal itself.
Exactly.
Okay. And basically,
and you have to identify and remove what's not working, what's blocking that health.
Yeah, right. Absolutely. And that can be from, as you mentioned, any heavy metals can be a block to healing. But we also know, and I don't know how much naturopathic medicine gets in. Maybe you can answer the question. In fact, I know you can. What about the emotional blocks that we may have, a traumatic experience that really is in our subconscious that we may not even be aware of, but I know for a fact that causes health problems? Do you get into that area also in naturopathic medicine?
Mm-hmm. Yeah, I try to, which is why when I, during the history, I also try to look for what their social life is like, what their relationships are like. Are they happy? What they do for work? I'm trying to assess maybe how stressed out they are as well.
Mm-hmm. Mm-hmm.
And it really kind of depends on the person.
Yeah.
Not everybody who comes in to see me, they don't all want to talk about the emotional component
Right.
to their disease.
I don't think any of us
So,
do. I think that's probably one of the biggest areas that I've seen, at least in researching cancer and understanding some of those other areas. The emotional component to any chronic disease is huge, and it's really big. It's one that none of us want to face because they're issues that are hard. They hurt us. They were, they're in some cases they were really terrible. And to go back and relive that or understand that can be a major, major factor in overcoming or helping our body heal itself. So it's like you said, nobody wants to do it, but boy, I think it's really important that we do, and that we get to that root cause of what's causing the chronic illness.
Right. There's actually, I'm not sure if many people here have heard about Louise Hay. She's done some really great work about mind-body connection, and she has this little book, I think it's called We Can Heal, or You Can Heal Yourself, and it basically lists the physical correlation to the emotional issue, a general overview. So it can be interesting for people to look into if they're so called. Mm-hmm. There's one more question from Travis. I think.
He asked, is fatigue caused from eating carbohydrates? And I think it's a great question. And Travis, feel free if you'd like to. There's an open seat here. You feel more than welcome to sit down if you're still in the room. I don't know if he is or isn't, but and ask the question. But can fatigue be from eating carbohydrates?
Yes, especially if it's related to insulin dysregulation. So what that means is basically not diabetic, but maybe going there if they don't take care of themselves. Mm-hmm. Because what happens is when we eat carbs, it's like we're on a roller coaster. We eat carbs, our body's suddenly like, wow, and we're going up in the energy field, and then we hit that plateau, and then we suddenly crash. And then it's on that crash that we can feel the fatigue.
And you're talking, I think when we're talking about carbs, we're talking about the simple carbohydrates. Most of the crap, if you will, that we eat here, particularly in the standard American diet or the SAD diet, those complex carbohydrates are what really, really hurt us. Mm-hmm. And it's the sugar that's added to everything that we eat. So I was going to ask you another question that ties right in with what Travis asked about the carbohydrates. What kind of diet or do you recommend to your patients as they come in? Do you have a particular recommendation? We hear so many things about paleo or vegan or ovo-lactarian, vegetarian, and just on and on and on. And high protein, low carb, high carb, no protein, high fat, ketogenic diet. All these different diets out there. What do you recommend to people?
It's frequently patient specific. So for someone with an autoimmune disease, I'll typically recommend they do basically a paleo diet. But if they have strong beliefs that they don't want to eat meat, then we'll work on doing some kind of vegetarian diet or vegan vegetarian. More vegetarian. I'm not. Veganism is a bit more complex, and I think it has to be done really right. And not many people know how to do that very well. So I tend to not advocate that with my patients. I don't think it's bad or anything, but I just notice it's harder for people to eat vegan and get all their nutrients if they don't know what they're doing. Yeah. And I'm not a nutritionist per se, so that would take a long time to explain with people. Mm-hmm. Frequently, for just a general person coming in, I try to emphasize eating vegetables first, mostly vegetables, like a plant-based diet with some protein in it. And if they want meat, great. If they want vegetarian meat or vegetarian protein, okay then as well.
Okay, excellent.
Yeah.
I had a couple questions. You talked a little bit about it. So the thing that surprised me when you said there's only a certain amount of states, so naturopathic doctors can't be found in all states. Is that correct? At least here in the United States?
Well, some naturopathic doctors can be found in unlicensed states, but they can't promote themselves as such.
Okay.
And so how they work, like Florida, for example, I'm pretty sure Florida is not a licensed state, but I know a few naturopaths who practice there.
Okay. Okay.
So
So
how they
so you're still governed by the American Medical Association, or is the governed body the Healthcare Act that you talked about, Obamacare, so to speak, that governs you?
No, we have our own association, American Association of Naturopathic Physicians, and they also take care of setting the guidelines for licensing with students and the boards. They also help take care of the accreditations of the colleges, so that every school that licenses naturopaths or that graduates naturopaths, they are licensed. They have a set of curriculum, they have a set of requirements.
Okay.
So it's pretty uniform.
So
And
so if you're my primary care physician as a naturopathic doctor, and I break a bone or something like that requires some surgery, whether it's major or minor, how do you handle that? Do you do surgeries, or is that something that isn't done in naturopathic medicine?
we do have some training in what's called minor office procedures. So basic stitching, some emergency procedures. However, I don't do it. I would definitely refer out.
Okay.
Yeah.
Yeah. Okay.
And I
That's
know
good.
some doctors who do because that's what they like to do.
Yeah.
That's not really what I like to do.
Well, I know that I've been following a little bit about the CARE Act, Obamacare, and I've heard recently that, for example, they're trying to change some of the ways the insurances work and the way they're paid. And for instance, the traditional once a year physical is they're trying to throw that out because of the cost involved to the insurance. So I guess what I'm getting at, coming back to you as my primary care physician, I would go to you first, because unless I'm dealing with some emergency that I need to go to the emergency room, I would still be able to come to you initially for pretty much anything, unless it's an emergency or an accident that happens. And then we can find out again what might be wrong and just keep on good course with good health through natural remedies and natural supplements, I guess, or some of the things that you would use with people.
Yep.
Okay.
Yep.
Excellent.
Prevention.
So, yeah. So talk a little bit about what you do with pediatrics. I know that was one of your areas that you particularly like and focus on. Mm-hmm. What are some of the areas that you're seeing with children, and what are some of the areas that you feel that you're able to really make an impact with children?
Mm-hmm. Some of the things that I noticed, well, is really the exposure to, and it goes back to environmental medicine. That's also one of my passions. Okay, so you'll have to excuse me, but no. A lot of the exposure to not only heavy metals really, but more specifically like plastics are concerning, because it causes endocrine disruption. So we're seeing a lot of children who are developing type 2 diabetes at the age of 8. Or a lot of girls who are starting their menstruation at the age of 8.
Wow.
And that's significantly earlier than it was 20 years ago, whereas the average start of menses was maybe 12, 13. So that's like 5 years earlier. And, I'm sure there's other causes, as well as the hormones in beef children are eating. So, but also the plastics, really, it's like a lot of plastics that we eat. Anyways, that is a huge thing that I'm seeing with children, and a lot of the parents who bring their kids to me, they frequently don't want their kids to be vaccinated as well. So that's another big issue that I see on occasion. They ask about vaccine schedules. It's a huge issue, I'm sure, in California as well, with the vaccine law. Yeah, it's mandated now.
Mandated for children in school. It's kind of to me, it's personally kind of scary. It seems like you're taking away our rights as far as some of them go here in the United States to conform consent. I mean, we don't have that informed consent. We don't have that law, or in California anyway, because they're saying to go to school, you have to have vaccines, which is mind-blowing to me. But what's your take on vaccines? And before you go into that, I'd like to step back. Young children that come in that are having some of these early onset normal body functions, but they're so much earlier. Is there anything that you can do to help them? Or is that just something that they're too far gone at that point already at 8 years old? That's scary.
No, I don't think they're too far gone. Really, the other part that comes into the component is educating the parent. And most of the time, the parents are really diligent about trying to reduce exposure, and they really want to help their kid. The other part to trying to help these children with their hormones and their endocrine, other than cleaning up the diet and trying to clean up their exposures, is also trying to boost like their immune systems. Basically, what I try to do is give them the minimum amount that they need to take, but to have the maximum impact. So vitamin C is a big one. I think that's really helpful. Fish oils are also good because it's protective of their neurons, helps build their brain, and it helps with their immune system and decreases inflammation. So for children who I'm seeing with that kind of trend, the other thing that's kind of interesting to look into as well is a lot of the issues that these children have, it's because of the exposure to the mom. So it really goes back generationally. And there's also a big research going into epigenetics as well as DNA sequencing for, and I don't really want to just throw out names because it can be kind of confusing, but for example, looking at methylation function. These are, I have 21andMe, I think it's 23andMe. That's one example of the DNA sequencing and mutations that the research is going towards. And that seems to be where one pocket of research is really heading towards, is looking at the genetics of disease to try to prevent it. Because the concern as well in terms of research is these children, when they have children, it sort of just gets amplified because they're not damaged, but they've gotten a lot of exposure, so their DNA is already somewhat slightly altered, and so when they have children, they'll be passing on that DNA. So it's a really tough and controversial topic in terms of how to treat these patients so that we can heal their genes. Like, how do we heal their genes? Then it's really their epigenetics and the cause of it.
So are you working in some of those areas now as far as that goes? Or in terms
of research, no, I just try to read up as often as I can and stay up to date with the change, because it's changing so fast and constantly. And I really try to emphasize just reducing exposure and helping detoxification systems. Because going back to plastics in our environment, and I think we've all heard about endocrine disruption caused by plastics, PCPs, phthalates. That's why there's this whole new, like the Hydro Flask. I don't know if you've heard of the Hydro Flask. It's really popular in Hawaii, and it's basically a stainless steel water bottle. And it's really popular because of the transition away from plastics, away from BPA. And like
what I have here, that get away from this is what you're saying?
Yes, get away from that. Because when it gets heated up, it leaches tons of plastic chemicals into your water. Then you drink that, and it actually gets stored in your body, and it's a lot harder to get rid of than heavy metals. It's a lot more of a problem. It is. Wow. I actually had there was a man, I think he is 35. He came into our office yesterday to review some labs, and one of the labs was progesterone. And he's a 35-year-old man with low progesterone levels and who's having hot flashes at night. That is not normal.
No, no.
That is not normal at all, right? And and he also had some elevated liver enzymes and elevated glucose. So to me, and there's not too much research on how to identify plastics in our body, but there is some beginning research on looking at liver enzymes and as an indicator for plastic toxicity in your body. And so he had elevated liver enzymes plus low progesterone plus hot flashes. To me, I'm seeing his symptom picture as he's having a lot of endocrine disruption going on in his body. And he works at a bike shop, right? He owns a bike shop. So that's a lot of exposure as well to bike tires.
Yeah.
That's a lot of plastics or, rubber. So that's how I would look at his picture as well.
So what do you do with a guy like that? Where do you, what is he, how are you helping him?
Yeah. Well, first off, we have to try to clean him up, get his liver supported, try to get all that plastic. See, that's the thing too. There's not a lot of research on how to get the plastics out of the body. There's more understanding of how to avoid it. So for him, we've obviously got to support his liver because that's his main pathway of detoxification. We have to try to rebalance his hormones without really giving him hormones, right? So kind of looking more at plant-based support and herbs. Again, I think we gave him Pro Omega. What else did we give him? Helping him to lose some weight because he was a little bit overweight. So the fat is also a hormone cell. It also gives off hormones. So if we try to, hopefully if we can reduce his fat content in his body, that'll also help reduce help balance out his hormones.
Sure.
Getting him to eat properly because I think his diet was a little off as well. He wasn't really eating very good or in a timely manner.
Now, with what you just said, is he feeling better? Just obviously we don't.
Well, we just started yesterday.
Just started. Oh, okay.
Yeah, we just got his labs back.
Okay, great, understood. But traditionally, when you see people like that, how long does it take for people to notice a difference when they go this naturopathic way as opposed to a prescription medicine? That I go get a prescription. Let's say I've got a sore throat and a sniffly nose and I'm all congested. They give me a prescription. I go down. I feel better after I take the pill for a few days, and it helps me get through the symptoms. Doesn't help the underlying cause, but it helps me get through the symptoms. And that might take 3 or 4, a week or 2 to get through the actual over the cold or the flu. But when you do it naturally, is it faster, or do you notice, is it still about the same? You get the same results, I guess, or better without the synthetic products of the drugs.
So do you get the same results or better with natural remedies? And if you're coming in for a sore throat and a cough, if it's caused by strep throat, you're not going to get better with natural remedies. You need to have an antibiotic. But we can use natural remedies to help soothe. Like once we give you the antibiotics, there's going to be a sequelae because you give the antibiotics, you're killing everything in your gut. You're also going to have what I like to call the debris. Sorry, hold on. I'm not sure if there's noise coming in. Okay.
It's all right.
There's also going to be debris because your immune system will be killing the virus. And in that process, there's going to be inflammation. There are going to be cytokines. There are going to be dead pathogens, and that needs to be cleaned up. Okay. So you can give natural medicine to help the recovery time be shorter.
Gotcha. That makes total sense to me. Yeah. And obviously, what you didn't mention there by the natural remedies or medicines, and they are medicines, just because they're natural doesn't mean they're not very, very effective and highly effective. Right. You don't have all the side effects, which is the nice part about it. There's so many side effects. You watch any commercial on any drug these days, and the side effects are longer than the benefits. And it's just, it drives me crazy how anybody can look at those and think, man, there's just got to be alternatives out there. Anne asked a question. What's the best way to determine, there it goes, came up a little different. What's the best way to determine food allergies without expensive tests? But if I test, if a test is needed, what test do you recommend if I need a test? I think she meant to say.
Yeah. Well, when I was in school, what the gold standard was for food testing is basically called an elimination diet. So you basically eliminate everything from your diet, and it depends how you want to do it. There's a more extreme version where you just eat, I think it was sweet potatoes and maybe brown rice and lamb for about 2 to 3 weeks. That's like really extreme. I had some friends do it, and that can be very difficult, especially if you happen to be allergic to those things.
Yeah.
Right. Yeah. So that's one way. You eliminate pretty much everything from your diet for about 2 to 3 weeks, and then you slowly reintroduce one food item at a time. Another way of doing it is sorry, I was looking at another question. Another way of doing it is you maybe just go to plant-based, all greens. So you can do it that way, and then you slowly reintroduce one food at a time. But basically, with any elimination diet, you're eliminating grains, dairy, meat products. You should eliminate nightshades, eggs, soy. Peanuts. Those are the most common food allergens. And then you go to a very simple plant-based diet that has a low allergenic profile. So tomatoes is out, but lettuce, kale, chard, you can do sweet potato, and you keep it very simple. And then the 3 weeks is required because it's trying to get all of your exposure out. So your body kind of calms down, gets used to not having any of those substances in your body. And then when you reintroduce them, you only reintroduce one food at a time, and you wait 3 days for the reaction to happen.
Okay. So that's the elimination part. You eliminate them all initially, all the potential allergens that might be causing the problem. And then you introduce them one at a time for 3 days each. Exactly. And if you're not having any of the symptoms, then you know you're not allergic to that food. So that makes total sense. Obviously, that'll save you some money. It's a little more timely, but it's also a natural way to do it. And it seems like that would be a very effective way. Randy asked, and I was having troubles with it. Let me see if I can get it. Can't get the question to come over to the main sequence for some reason, but Dr. Griffith would give me a dark pine tar type liquid to swab on my throat. Do you know what that liquid is? And I'm not sure who Dr. Griffith is or what that may be. Do you have any idea what that may be?
What were you using it for?
Randy, if you're there, what were you using it for? In fact, if you want to take a seat and come in, you can explain it. Here he comes. Let's see, we get Randy on here and see if he's working. Please start your camera.
There it is.
There you go.
It just took a few seconds.
Welcome, Randy. And
thank you. Yeah, it was for like sore throat, strep throat. Dr. Griffith is a naturopathic doctor and a midwife who practiced in Linwood, Washington, and taught at the school that you went to.
Oh, nice.
So I don't know if you knew him or not, but he's getting up there in age right now. But
nice. No, I didn't meet him.
It was this horrible tasting stuff that he'd have me dip a long Q-tip in this liquid and go back and swab it on your tonsils.
I don't know. I feel like I could probably find out.
This was like 30 years ago, so I'm trying to remember.
I don't know, and that's unfortunate.
Yeah. Okay.
Let me ask you this, Randy. Did it work?
Yes, it did. It worked very well. That's why I wanted to find out what it is again.
Oh, okay. So you don't have any more. You're out of it.
No, it was many, many years ago. And he was a midwife. He delivered my son at home.
Wow.
Nice. And insurance did not cover naturopathic doctors back then. And because, we wanted him to deliver our child, he had his attorneys push the insurance companies here in Washington to start covering midwives and naturopathic doctors.
Oh,
so that was one of the things that kind of kicked off them being covered in the state of Washington. So
Great. That's great.
Do you know what his first name is?
Lester, Dr. Lester E. Griffith. Griffith or Griffin? It might have been Griffin. Like I said, it's been a long time, but about 10 years after we started going to him, he closed his practice in Linwood and went to full-time teaching.
Oh.
And he taught at Bastyr College? Is that where you're?
Well, he taught in downtown Seattle and at Bastyr.
Oh, very good. So yeah. You're a perfect candidate. I'm glad you sat down here, Randy, because obviously, what we're talking about, for most people don't know about. I just got introduced to naturopathic medicine a couple months ago through my wife, an issue that she was dealing with, and all my research kind of led to naturopath as being a great alternative to some of the traditional medicine that are out there. And so it sounds like you've been using it for a long time with your family. Yeah,
1982 is when we actually started going to him.
And how many kids do you have, if you don't mind asking?
We have two.
Two, and have they been raised as that was their primary care type? Was a naturopathic?
That was until Dr. Griffith closed his practice and moved.
Okay.
But we did mostly naturopathic and chiropractic, and Dr. Griffith was I think he was kind of unique in that he had this room in his office where he mixed his own herbs and medicines. I don't know if naturopaths still do that. You do?
Yeah,
okay.
Some do. Yeah.
Yeah, I was curious about that.
Get now.
I forget
mixed up.
Yeah, I forget what they call that, but
tinctures.
No, a person that mixes their own medication.
Oh, apothecary.
Something like that. I don't remember. Like I said, it's been too many years now. So
why did you choose that type of medicine over the traditional? Just curiosity.
Well, because traditional medicine just really wasn't doing, like Dr. Lopes said at the beginning, that they treat the symptoms, not the cause. And we wanted to get more into what the cause of certain situations were.
Yeah.
Certain ailments. Right now I have AS that I'm getting treated, but it's being treated traditionally as opposed to naturopathically.
Okay.
So, and I want to learn more about the naturopathic remedies for AS.
I don't know if that's something that you know about, Dr. Lopes. Maybe you could answer that question. I'm not. When you say AS, are you what actually?
Ankylosing spondylitis. It's a form of rheumatoid arthritis, inflammation of the joints and whatnot.
Okay. Is it all your joints, or is it?
Pretty much, yeah.
Okay.
But it's I was in so much pain for a long time, and I had to do something, so I started getting Remicade infusions, which I don't really like that much. But 99% of my pain is gone now.
That's
so, but I'd like to move over towards something that's more naturopathic.
Yeah, I have a friend at Bastyr who was an ND acupuncturist, and he also had ankylosing spondylitis. And then when he was talking with me about it, he was basically doing no gluten at all, no dairy, as sort of being the first step to helping him. And he noticed it was significantly better as well. And then in terms of other things to do, there's this man, I forget his name. I'd have to look it up again, but he basically is an ND, MD, and DO. And he's quite prolific with writing, but he talks about treating autoimmune disease with hormone balancing and obviously the diet stuff and some other, I don't really want to get too into specifics, but that's Alex Vasquez. That's his name. He has had great success doing it that way.
So is he up here in this area?
He teaches a lot. He is in Spain, actually.
Oh, okay.
Now. but he has a lot of books out.
Maybe you can look him up on the web, is what you're saying?
Yeah, you can look him up on the web, and I'm sure there's other doctors that he's taught.
Okay.
Yeah.
Kind of an unrelated question Mike asked, and again, I'm having trouble moving the question over into the screen where everybody can say it. He asked, what is the best supplement for omega-3s? And I'm sure I know there's hundreds, if not thousands, of omega-3 supplements out there. But maybe is it better with some of the fish oil? Thanks, Randy, by the way, for sitting in and asking your question. Really appreciate it. What in your experience have you found as a good way to get omega-3s? I know personally I've been using some flaxseed and also some calamine type oil, which is a squid-based oil.
Yeah, I think krill is also good. I see the question from Mike as well. So I think krill is good. I think fish is good. If it's from a quality product, it has to be really rigorously tested. They have to have really good standards in terms of it's a clean source of fish omegas, because obviously, again, the mercury exposure would be bad. Krill, flax. I'm on the fence with flax for pro omegas, just because you have to take a lot of flax to get the same dose for an omega-3 as the same as fish.
Yeah.
But I know some people love it and they say it works better. And with flax, it also has 3, 6, and 9, I think, which it gives you like a little bit better diversity. Yeah, flax seeds can get rancid pretty quickly. The other one that I like for omegas, not borage.
Is there a particular brand that you prescribe through your practice, or do you tell people about any particular brand?
We use Nordic Naturals pretty regularly. You can find them easily in grocery stores. Oh, the other thing is cod. I was thinking about cod liver oil. Some people will use that as well. They like it because it also has vitamin D in it, and I think vitamin A, and it's less processed than the Pro Omega capsules. So those would be good. Yeah.
Okay, great. Hopefully that answered your question, Mike. If you want and you're so inclined, feel free to take a seat. We are at the top of the hour. We're just slightly past. So if there are any other questions, we want to get it wrapped up. I know that you said you were not on a real tight schedule today, so we want to try and answer any questions that people may have, and we've got some people coming in right now. So Christopher asked a question, and I can't get it over again, but do either of you have an opinion on meal replacements, Soylent or Vega One? And I'm not familiar with either one. My personal feeling, if Soylent is any soy related, I would avoid it personally. I just have read too much research about the problems with the GMO soy products and what they do and the estrogen effects that it has in our body. So I'm not a big soy advocate at all. In fact, I would try and stay away from any soy products unless there's some of the fermented. And then if they are fermented soy products, I think those are okay. But again, make sure they're organic and certified organic. That's my take on that question. I don't know if you have any to add to that, Dr. Lopes.
If you're referring to Vega, I think it's a brand.
Vega One is what he said. Soylent or Vega One, which I'm not sure which he may be talking about.
Yeah, I haven't heard of Vega One or Soylent, but I have heard of Vega, and they're like pretty easy to get, and it seems clean. I actually do like their products, Vega.com. I'm not sure if they're soy per se, but I think it's really clean. Most of their stuff's organic, easy to get, not from a practitioner. And there's another one, I'm trying to find it. There's another company that I like a lot, but I don't order it frequently because it's a bit more expensive, and to get it in Hawaii is very hard. The shipping gets kind of crazy to get things here, so I don't prescribe it very frequently. Thymogen, XYMOGEN. they're another good company, and I'm pretty sure they have meal replacements that are really tasty.
Good. So what's your take on the whole GMO, organic, gluten-based, grain-based? What's your take on all that?
I don't agree with GMOs. And it's funny because for those of you who don't live on Maui, it's a huge issue here.
None of us.
It's a huge issue here. We have Monsanto farms all over the place. And last year there was just a moratorium that went through, a bill to try to get Monsanto to stop with their plants, with their planting of crops and spraying until research can be shown that it's not dangerous. So that moratorium went and was voted on in the county, and it actually did pass. I think it was a 51-49 for the moratorium. And so it's a huge issue here. I don't think it's healthy for people in their bodies at all. There's just not enough research to actually qualify that it's safe, even though they say it is.
I think there's plenty of research to show that it's very detrimental, just the opposite. And they don't want to show that. But anybody that wants to dig into it, I've dug into it fairly in depth, and it is dangerous. It is deadly in some cases for us. It's just something that you got to avoid it if you can. It's very hard.
Yeah.
We all live in this society where literally 90% of the food out there is not organic. And now we're finding even in some of the organic foods that are labeled organic, that are processed, if they're highly processed, you still got to be suspect because they can have ingredients in them that are still detrimental to you. Mm-hmm. Ultimately, that can cause some problems for you. So you still got to be careful. But for sure, choose organic whenever you can. And I would take it a step further. Almost everywhere now, particularly the United States, if you live anywhere near any size metropolitan area, they have all kinds of farmers markets now. You know, support your local farmers that are trying hard, that are raising good, nutritious crops for us, and go out and support them and buy them. Buy your eggs from a local farmer that lets their chickens run wild and eat what they are supposed to eat, not the crap that are fed to them by the chemical companies, literally, that are nothing more than chemical. Same with the beef that you eat. If you're a meat eater, try and eat grass-fed beef. Free-range beef obviously is better for you. We know that. The science is there to prove it. And not to mention the lack of hormones and other antibiotics and things that you're going to be putting into your body by eating the traditional meat sources. It's terrible out there. It really is. So you got to do the best you can. Angel asked a question: are you folks familiar with resveratrol in terms of preventing cancer or other illnesses? I'm familiar with resveratrol. I know there's a lot of claims on tons of different supplements, and resveratrol is just one of them. And almost every supplement will try and tell you that it's going to cure cancer. My only question to that is, or preventing it, as your question stated, is there is no silver bullet in anything that's going to cure you, one item that's going to cure you of any disease. I believe that what we're faced at when we're looking at any chronic disease such as cancer is it's a huge jigsaw puzzle, and we have to do our research and understand. And one of the things that I like about naturopathic medicine is that they go to the natural things that have been proven throughout hundreds and in some cases thousands of years of proven scientific evidence that can show that it will help the body naturally heal itself. So resveratrol, very good substance. We know it has some very, very positive things in the body, but at the same time, it's only one of the many, many things that you need to look at. And as Dr. Lopes pointed out, you've got to understand where your body is at in terms of its general physiology, and then be able to start implementing the supplements that you may need to help your particular symptom. Everybody's different. And I think that's what makes this whole crazy world that we're in of supplements and and different doctors telling you one thing and another doctor telling you something totally different is because we're all unique, but yet we're all in this together. And the earth is a wonderful place that has given us so many natural things to help heal ourselves that we have to look to those first, in my opinion. Because if you look to big pharma to save you or to cure you or for that silver bullet, is all they're going to take you down is a really slippery slope that isn't going to get you better. I can promise you that. I've got friends that have died recently of cancer and that have gone through the traditional ways of treating it, chemo, radiation, and surgery, and it just plain doesn't work. And I don't think there's anybody that can refute any of that, what I just said. And I hope Dr. Lopes may agree. If she doesn't, that's fine too. That's just my opinion. My little rant for the day. And I always get, Teresa will tell you, I always get on these little rants, every one of these blabs, but I'm passionate about that. And that's one area that we have to start at. If you look at me, obviously, I was a lot bigger than what I am now, and I've got a long way to go still on my own weight. But I know that by eating properly and getting the exercise that I need, my body is changing. I feel it, I see it, and it's different for everybody, but yet it's the same for everybody. We have to find out what works for our own bodies, and that's the one wonderful thing that I liked about naturopathic medicine is that is what they teach you. They're there to teach you and to help you figure out what your body needs right now to get it to a healthy state. And I hope I said that right. I hope that makes sense.
I think another way of putting it is that if you believe, like I believe that our bodies are wise. Our bodies know exactly what it needs to do in order for us to live. And when we're able to give our bodies what it needs and we're able to take away what it doesn't need, then our bodies can naturally, they know what to do. Because if our bodies didn't know what to do, we wouldn't be able to live. We wouldn't be able to have a cut and have it heal, right? It just, if we get a cut, our body knows exactly how to heal.
Absolutely.
And so that's really what naturopathic medicine strives to do, is to compound on the wisdom of the body by identifying things that are harming the body and also giving the body what it needs. And then in terms of like the resveratrol, I would also add that really the action and mechanism of resveratrol is that it is an antioxidant. So it is a very powerful and strong antioxidant. I believe it's actually it's like a purple compound. If you look at it in plants, it's going to be any kind of purple compound like grapes, beets, and so it's going to have anthocyanins, and that will be what's causing the antioxidant capacity, which is really, again, going back to the whole conversation about inflammation being the silent killer. And that's, I think, the mechanism of how that works as well and why it works.
Well, great. I think we're way past the hour right now. We're at 20 minutes after, but I guess first of all, is it mahalo that I say saying thank you?
Yes.
Is that the way to say it?
Yes.
So huge mahalo to you, Dr. Lopes. Just really appreciate you being here today. And with that said, I think even more about naturopathic medicine now that I've actually heard this and heard your take on it, because it has such a place for all of us here, not only in the States, but worldwide. We have to get back to nature as far as I'm concerned, so that, like you said, our body is a perfectly designed machine to heal itself. And again, I think it's the only thing that is going to heal itself. Mm-hmm. Your body has to heal itself for you to get over anything. Medicines, pharmacies, even doctors can't heal your body. Your body has to heal itself. We can give it the right things, and if we do give it the right things, it will heal itself. And that's one of the things I'd like to take with this. But again, mahalo to you, and thank you for being here. With that said, do you have any final comments you'd like to wrap it up with? I always like to leave that up to you and do whatever you'd like to do on that.
I noticed a really quick question. What about magnesium? And yes, I think
okay.
everyone needs magnesium. The vast majority of people are magnesium deficient. And then with that, thank you for having me today. I had a great time, and I hope that everyone was able to find some pearl that they can take away and use in their daily life to make them healthier, happier, and living on a better, healthier planet. Thank you.
I know I did. So again, thank you so much for being here. I got a lot of wonderful pearls, and like everybody knows that are here in Blab, you can watch the replay. The replay will be up shortly. You can also go to our website and see the replay once that's up. Thank you all for being here, and in the Hawaiian spirit of Dr. Lopes, mahalo to all of you, and have a wonderful day. Thank you again, Dr. Lopes, and we'll be talking soon, I'm sure.
Great.
And look forward to maybe next time having you. Thanks so much, everybody.
Thanks, everyone. Bye.